Hello, everyone. What are the muscles that are attaching the part of the spine, the scapula, to our arms? Do you know that there are many muscles and sometimes you cannot memorize them? I will give you a short story about how ultimate the muscle puzzle is that. My name is Dr. Sinan Adnan, and I'm an orthopedic surgeon from Germany. And I will talk to you about an easy way to know every muscle in our limbs. Let's begin with the spinal muscles. The spinal muscles are these parts, these are the five muscles that are attaching the spine to the upper limb. Let's go for the first one, is the trapezius. Now you know that the trapezius, it looks like a trapezoid shape, like this one, and then it is attaching the spine, the cervical spine, and the thoracic spine as well, like you see here. And also, this is the origin, and also it is inserted in the spine of the scapula, as well as the part of the lateral part of the clavicle. From its shape, trapezoid shape, that's the name is trapezius. The second one is called a latissimus dorsi. Latissimus dorsi is a large muscle from the part of the back and the spine as well, and there are many fibers. All of them are attached into the humerus in the upper part, exactly at the intertubercular groove, where it looks like flipped away and then attached here. This is the insertion of latissimus dorsi. If you don't know the name, latissimus in Latin means lateral and dorsi from its position in the dorsum. The next is called rhomboids muscle. Rhomboids, it means this part, which is a little bit rectangular in shape. So the rhomboid major, it's a larger one, and it is attachment from the spine into the medial border or the vertebral border of the scapula, usually the inferior two-thirds. The next one is rhomboid minor, and it's also a rectangular in shape, but it is less width, and it is attached also to the medial border, especially at the upper part of the scapula. The, the last one is levator scapulae, and from its name, it is called levator, so it elevates the scapula. And you know that these attachments here originated from high above the cervical levels, and attachment here and insertion to the superior pole of the scapula. Let's go for the chest, and you know in the chest there are pectoral muscles. Pectoralis major, pectoralis minor, and serratus anterior. For pectoralis major muscle, it has two heads, or sometimes three. Like you see, this is the clavicular head, which is here, and this is the sternocostal head. And sometimes they added an abdominal head with this muscle of external obliquus muscle of the abdominal wall. These heads altogether, they converge here in the lateral part of the chest, and then it is attached to the lateral of the bicipital groove or the intertubercular sulcus of the humerus. The pectoralis minor, when we remove this part of the pectoralis major, you can see here a small muscle from the ribs 3, 4, and 5 and goes cephalad into the coracoid process of the scapula. These muscles are very important in pressing. The next is serratus anterior muscle, and it is so much in the deep area at the medial border of the axilla. And serratus means a serrated part, and you can see how originated from the first 9 ribs and inserted into the medial border of the scapula. Now let's go for the shoulder movement muscles. The shoulder here, first of all, is the deltoid. Deltoid means delta, which is an inverted triangle. It is in the lateral aspect of the upper part of the arm and has three heads, anterior, middle, and posterior heads. And they are all originated from the clavicle, acromion, and the spine of the scapula, respectively, and they are inserted into the deltoid tuberosity of the humerus, and it is supplied by the axillary nerve. The deltoid is a powerful abductor beyond 20 degrees of the shoulder joint. The other four muscles are SITS, S for supraspinatus, I infraspinatus, T teres minor, and the last S is subscapularis. For supraspinatus muscle, it is in the deep. While we remove the trapezius here, you can see now the supraspinatus muscle, which is above the spine or in the supraspinous fossa of the posterior scapula. And you can see here, it goes underneath or inferior, to the acromion, and then superior to glenohumeral joint, inserted into the greater tuberosity of the humerus. Likewise, in the infraspinatus muscle, also from the scapula, but from the infrascapular fossa posteriorly, and then goes along the greater tuberosity of the humerus also, in the middle facet. And then we have a teres minor just below the infraspinatus, again, from the lateral border of the scapula into the greater tuberosity here. So you can see the greater tuberosity has three facets. The superior facet for supraspinatus, the middle for infraspinatus, and the last is inferior for teres minor muscle. And you know that teres minor, it forms as a letter M for the humerus and both scapulae with this part of the muscle. How about subscapularis? Subscapularis is the last muscle here, and it's in the ventral part or the costal surface of the scapula, and here it is attached to the lesser trochanter or lesser tuberosity of the humerus. The teres major muscle is one of the muscles that is attachment is very not like these muscles. You know, from the posterior part, inferior angle of the scapula, posteriorly, and then it goes laterally backwards into the humerus, and then anteriorly goes and attached to the intertubercular sulcus just medially. So that's why the teres major causing an internal rotation. So let's write a comments. What do you know? What you will need to show in the next session? Thank you very much and have a nice day.